Adoption is deep in Australia's psyche. If you work in this field, you can be at any kind of function, and particularly a function that's not dominated by human service people. And invariably somebody from the corporate sector or from anywhere will say something to you about adoption. What really happened in the forced adoption? What about the stolen generation? What about, am I able to adopt? What's fostering really like? People sidle up beside you and ask these questions. And I think also it's deep in Australia's psyche because of the history, because of our history of forced adoption, because of the history of the stolen generation. But I do really want to acknowledge the past bearing down on us. As professionals and practitioners, we try and pick our way through. Because it is hard sometimes in that environment to actually hear the voice of children through it. And I think that it has been the voice of children that we've heard that have actually led us to where we are today, to really start to think differently about adoption in out-of-home care. And it's generally been the experience of children who have been adopted in out-of-home care who've really raised this to professionals' area. For family and community services, in 2014, our Safe Home for Life changes after a considerable period of discussion in the sector really directed us to consider open adoption for all children in care who might benefit from it. So when children enter care, our first preference is always to safely return them to their families. And when that's not possible, guardianship by kin or other close contact is the next option we consider. We know that you as workers work tirelessly to meet these placement goals for children in care, but for some children, restoration or guardianship's not possible, as there's no realistic prospect of those children living safely with their families or kin. Or sometimes kin tell us that, look, I'm looking after the other children, I simply don't think it's in the interests of the baby or the next child for me to be able to try and take them on. In these cases, the permanent placement principles in the Safe Home for Life reforms direct us to consider adoption next as a means of securing a safe and stable living situation for non-Aboriginal children. If adoption's not appropriate, we should then consider long-term parental responsibility to the Minister. For those of you outside family and community services, this is a dramatic change. Most times when we remove children and don't think that there's a possibility of restoration, most of the orders that we go for are long-term parental orders to the Minister. And 97% of the time we're successful in achieving those. So for us to break that habit, and for those of you in the non-government sector that are used to providing long-term foster care as the option for family and community services, you can understand what a significant break from the past this will be. As I said, the voices and experiences of people who were affected by past adoption practices really need to inform our practice today. We've learned from the heartache that was caused to children, families and communities, and we continue to listen to their voices as we shape our new practice. But we can't just say that, we really need to demonstrate that. I think that in fact having adoption as an option will really change our child protection practice. In fact, we'll be really clear that if we are really going to remove children, that we have to be clear that we've absolutely utilised every form of support to be able to restore that child or to do whatever we can to be able to help those parents parent. If we really are convinced and are able to convince the court that there is no more we can do, then we can move on to adoption. But I think it will really change our child protection practice. So I look forward to working with all of you today to discuss how we can examine individual children's needs to ensure they not only grow up safely but also flourish. Thank you and welcome for today.
There's a lot of confusion when we're talking about whether our resources should be around family preservation versus child protection. And the confusion is largely because we treat the population of children who are maltreated as one. And what I'm trying to show here is that, in fact, the children who are manifestly in need of care, those that have ongoing need for care, are at the sharp end of our business. These are the children that experience the most severe, the most chronic, most pervasive and most diverse maltreatment. And you'll see that they're actually a relatively small group. The vast majority of children that are known to this department fall below the line, not above the line. Now, family preservation philosophy, ideology, policies, I think a critical appraisal of the last 30 or 40 years, and Scandinavia is probably the best example of this, would suggest that these policies and ways of thinking about families have actually been enormously beneficial. And I think it's important to acknowledge that, because some of the kind of politicized debate that's going on at the moment in Australia around adoption treats this as a single population. And the problems that I'm going to be talking about today are seen to be a consequence of a failed approach to family preservation. So first of all, I want to say that's not the case. Family preservation focus and all of the money that we're spending on it and all of the good work that we're doing actually works for most children. But it fails, and in fact it is harmful, at least in the way it's applied now around the world, and Scandinavia again is the best example of this. It harms the development and well-being of children who are manifestly in need of care. I don't have time today to explain why, but perhaps it will become a little bit apparent as we talk. So my interest is children who are in need of care, and largely children who have ongoing need for care. It's important when we're thinking about these children not to think of them as just like any other sample of, or any other group of children who are referred, for example, to child and adolescent mental health services. Their problems are different. The most defining feature is not the forms of disturbance, but their complexity and severity. And one of the sort of key markers of these problems are interpersonal relatedness or attachment difficulties. So they're like hallmark features. So in terms of different, this kind of complex and severe psychopathology, we can see children with co-occurring attachment difficulties, relationship insecurity, various trauma-related symptoms, inattention hyperactivity, conduct problems, defiance, it goes on and on and on. And these unusual things that are seen less often amongst clinical referred children at large. Now, the important thing from clinical research point of view is that much of this isn't adequately conceptualized within standard psychiatric diagnostic systems. So looking at mental health profiles from my longitudinal study of children in care in New South Wales, this is from 347 children, and this is the baseline data gathered from 1999 to 2002. And we can see that around 30% were okay, they just had, their level of difficulties were just normal. 15% had elevated subclinical difficulties. Around 35% had clinically meaningful mental health problems that could be meaningfully understood within diagnostic systems. So psychiatrists using the DSM or clinical psychologists using the DSM could make a kind of coherent and diagnosis. But this is the really interesting group. 20% of all of those children had marked and complex symptomatology that wasn't adequately conceptualized within standard diagnostic classification. So the important thing about this is you put all of that information up, it's a bit hard to sort of digest it and soak it in. There's all these kind of statistics and jargon and labels and all that kind of stuff. It behoves us to think and just try to reflect a little bit on what this means for these children. How is this experienced? And what is their felt experience, and also what does this mean for their lives? Firstly, it's important to understand that these children are doubly harmed. They are harmed in terms of their exposure to maltreatment, their experience in the present or in the past of various types of abuse and neglect, their experience of systemic harm through coming into the care system, but then they encounter developmental harm. And so that's harm that actually goes on into the future, and it follows a lifelong developmental course. And for many of these children, it has lifelong implications for social, educational, and occupational functioning. And importantly, from the point of view of child protection policy, it accounts for intergenerational transmission of trauma and attachment difficulties. So, the felt experience, I've skipped past that, it actually is quite hellish. For a child to have all of those things that I've put up on the board, it's not just that they're naughty children or that they're difficult to care for. Actually, being a person that has those ways of seeing the world and feeling like that is nightmarish. It's very difficult for most of us to be able to relate to or understand that. This is the preamble, because really what you're wanting to know is what causes these difficulties and how that relates to alternate care and adoption. Really, the way I think about this is that there are two main determinants or causes of those problems. The first is children's pre-care adversity, and this is actually the most important exposure. And this is just these are what I've described with those mental health problems are the effects, by and large, of exposure to chronic and severe maltreatment. And the second type of difficulties is what happens to children after they come into care, what I call within care adversity. And this includes a reverberating impact of impermanence and flawed care systems. So the interesting thing, of course, is that the second thing is not just happening to children at large, but it's happening to the most vulnerable, most disadvantaged children that we know. So it's like piling adversity onto adversity. And I'll come back to this as a theme further in my talk, the idea of the importance of very powerful interaction and cascading effects. But the key psychological construct, the main take-home message about the effects of impermanence is felt security. For me, felt security is much more important construct than attachment security. And the reason for that is that alternate care actually is a very unnatural and extraordinary experience. And it's not just because of the nature of family life within out-of-home care placements. It's also the nature of the relationship between the family and the state, and so even a child who is securely attached, in many instances, will feel very, very insecure in that system. And so, felt security. Obviously, developmentalists will understand. Attachment theorists understand that the most important framework or basis for felt security is attachment security. But felt security really is how it is experienced in the now as a result of all of these different things. Getting back to pre-care adversity, it's very important to keep in mind that the strongest predictor of the presence, severity, and complexity of mental health difficulties is a child's age at entry into care. Where children who come into care at younger ages have much better development than children who come into care at older ages. And this partly accounts for the kind of myth that because the myth that children who come into care, that their mental health gets worse the longer they're in care. The reason that myth emerged is because if we just look at how mean mental health deteriorates over time, cross-sectionally, it's accounted for by progressively older and older children coming into care with worse and worse mental health. So with every further year of age where a child has experienced chronic and severe maltreatment, their development is impaired that much more. And the challenge for this department in terms of being able to meet that child's needs and try to do what's in the best interests for their well-being become progressively harder and harder. So there's a strong linear relationship. It's not confounded by other factors, including genetic and prenatal risk exposures. An aged entry into care provides a very good approximation of length of post-birth experience to severe social adversity and specifically child abuse and neglect. So in other words, what we're seeing here is the impact of cumulative trauma exposure and failure to form attachments, particularly in the first 5 years of life. So, as I said, therefore, we look at these children coming into care, particularly the older ones, extraordinarily disadvantaged, extraordinarily vulnerable at the point of entry into care. But the story doesn't end there. Things don't just get better for those children. For those children who are older, and sometimes they do get worse. So, what are the causes of mental health problems for children within care? Firstly, quality of care, caregiver commitment, caregiver bonding. Very important research by Mary Dozier in the United States on this area. Now, that's the case for all children, of course, quality of care, caregiver commitment, and caregiver bonding. But quality of care, I've spent the first half of my career I spent working with foster families. And like many of you, I've witnessed an extraordinary spread of quality of care. There are some foster parents that I've met that I just wished I could clone them, that are just the most remarkable people that you could ever meet. And when you see not only what it is that they take on and what they're confronted with on a day-to-day basis, but their loving, unconditional commitment to these children is remarkable. And then, as I'm going to explain in a minute, there are many, many caregivers who have the capacity to do that, but the system works in a way that it disincentivizes commitment, particularly unconditional commitment. And then there are caregivers at the other end of the spectrum who you spend time with them, you look at the file, children are removed from their care, and honestly, you just cannot figure out how on earth that they were approved to be foster carers. So, quality of care is important. Caregiver commitment and caregiver bonding are less linked to the caregiver's personal qualities and personalities and themselves, and are more linked to how it is that we operationalize care. Maltreatment in care obviously is important, and there's some research from my longitudinal study on this, and a colleague of mine, Nina Bihar, did a good review of the effects of maltreatment in care that included the New South Wales study some years ago, if you're interested in reading about that. Importantly, the New South Wales study was one of the very first that identified the possibility that perceived placement security, and in terms of children's and caregivers' felt security, it may not be a determinant of poor mental health, but it could very well have a modifying effect or be a kind of mediating variable around children's mental health deteriorating. The big one that's really important, and which the title of my talk today was meant to be focusing on, which I'm going to try and get to, is placement instability, breakdowns and planned placement moves. So you notice that placement instability, I've not just talked about breakdowns, I've talked about when FACS shifts kids around for other reasons, including the use of temporary care. So, when we think about this, again, it's useful to reflect on what this means for these children and what the experience is. I'm sorry for the audience back here, I've got my back to you, but I'm actually reading off a screen here. This is just, the more you sort of take a step back and look at this and think about it, the problem for most of us is that we're within the system. It's always harder when you're within the system to get a kind of perspective on what it is that you do and why it is that you do things certain ways. Why do you think about things in different ways? But really, out-of-home care largely is very unnatural. And here I've said unnatural childhood is the extraordinary developmental risks encountered by children in impermanent out-of-home care. So firstly, the developmental risks are systemically interconnected. So, in other words, how we as a child welfare agency, child welfare system, the courts included, how we do our work links to all of these family factors and to things like felt security. There's a complex interaction of child welfare practices, caregiver motivation, the child's experience of impermanence and felt security. This is what I think is the core problem. Children growing up without unconditional, lifelong commitment by a loving family. So even if we could fix all of the systemic things around, bad practice. When I say bad, I'm not wanting to sort of say that we do bad things on purpose, but it just is bad. It still doesn't overcome this problem of what it is for a child to grow up without unconditional, lifelong commitment by a loving family. And the state really is a poor substitute parent. And, we all go to work. Just to think about it, think about the difference between going to work and working with the children that we work with, and thinking about what it is, the decisions that we're making for them, the lives that they lead, and then what it is that we do for our own kids, and when we go home from work at the end of the day. On almost every count, child welfare practice fails the test of what would I want for this child if he or she was my child or my grandchild. So, Indira, how am I going for time? You're fine, another 10 minutes. Another 10, I'll go really fast on this. And a couple of examples. Okay, when I first joined the department in late 1989, at least for a few years when I was in the department, some of you would have been in the department then, perhaps as well. There was a term that was used called adoptive parents in disguise. Remember that? So this was a term that we used to describe foster care applicants who were bad foster care applicants because they were adoptive parents in disguise. These were people who really were wanting to foster because really what they were wanting to do was to get a child and keep them. And because they wanted to do that, it meant that they were going to be unprofessional. They wouldn't give them back. If they gave them back, they'd go to the complaints. I can't remember what all the different tribunals were. They were really difficult foster parents. They would argue. They would give everyone nightmares. We'd be traumatized by them, etc., etc. And so therefore, what you had to do was find the secret adoption ones and screen them out. Now, everything that we know from developmental psychology tells us that those were probably the best people for the children, to care for the children. The problem is that our policies then, and to some extent now, weren't aligned to the idea that these children would be raised by these foster parents. So we still have this idea that our first, the goal of foster care is wherever possible, is to return the child to their parents' care. And yet, if we look, for example, in Britain, where it's the same goal, if we look at foster care, it's not that different to here. By and large, most of these high-risk children come into care and they stay in care. And if they don't stay in care, the restorations are usually very unsuccessful. And so there's a mismatch between the stated aims of the policy and what was actually happening in practice, which is these children were being raised for their entire childhood in care. And so this is one of the things that we can fix if foster care is still a viable model. But it's a very interesting thing to be thinking about in terms of what is it that we're looking for in terms of good foster parents. A colleague of mine in Britain is an adoption researcher called Julie Selwyn. She's just publishing an article in a special section that I'm editing in Clinical Child Psychology and Psychiatry later this year on adoption from care. And this paper, it's now in press, so I can mention it. This paper is a very a very useful one and timely one for us here, because what it describes is a very big qualitative study of adoptive parents of very high-risk children adopted from care in Britain, where very large numbers of adoptive parents were saying that the children were saying to them that when they were in foster care, they were never hugged. And so when we looked into that a bit, or when Julie and her group looked into that a bit further, discovered that in fact many of the local authorities where these children had been placed from, where they'd been adopted from, that in fact there were policies around no physical affection, lack of physical affection. And obviously, in my mind, it was a policy that was designed to mitigate the risk of false allegations or real allegations of sexual abuse. But that's not how our children are raised. Our children, physical affection actually has a developmental purpose. It has an ecological purpose. It's not something that we as a state can engineer. Two great challenges of developmental child welfare. The first thing is we need to identify children who are in need of care at the earliest possible age and intervene decisively. So this isn't about adoption, this is about child protection. The single most important intervention that can protect the development and well-being of children who have an ongoing need for care. The second one is minimising children's exposure to harmful psychosocial developmental effects of child welfare practices and impermanence permanent out-of-home care. And I think I've got about 2 minutes. Is that all right? Okay. So this is what I think the policy implications are. Psychological permanency requires non-contestable orders. So people talk about, why do we need to have adoption versus other kinds of guardianship orders? I don't think we do need to have adoption versus other guardianship. The thing is not what it's called. It's not about changing your name on a birth certificate. It's not about how open or closed it is. It's about in terms of felt security, it's about the non-contestability of the order. So you don't have to call it adoption. You can have permanent guardianship with kin, with grandparents. In New Zealand we call it whānau, with whānau. Permanent guardianship. You don't need to change the birth certificate. I don't know how New South Wales is going to look at adoption reform in terms of birth certificates, but why can't a birth certificate have the child's the birth certificate is amended? It shows that the child was born to these parents on this date, and they were adopted by these parents on this date. It's simple. The second thing is decisive and timely determination of permanency. Restoration to birth parents, permanent guardianship by kinship carers, permanent guardianship by other carers. So in other words, it's all the time that it takes to get to that point has a developmental impact. We can't forget about that. And time is shrunk down. When the younger a child is, the more time is shrunk down. The more time is a player in all of this. And so particularly for 1, 2 and 3-year-olds, we have to be mindful of, 6 months here with this person, 6 months here with that person. It's actually potentially catastrophic for their development. Whereas for a 6-year-old who knows their family, knows their parents, they may have really difficult feelings for their parents, but they'll never forget who their parents are. And 6 months with a temporary carer before they go to another permanent carer is going to have less of a developmental impact. Greater awareness of the developmental impact of planned placement moves, including use of temporary care, especially for children aged 1 to 3 years. Contact with birth families needs to be guided by specialised, comprehensive psychosocial developmental assessment, not by rules of thumb or practice guides. And what about those children who remain in permanent forms of care, such as foster care? So a lot of those children that I've spoke about who come into care at older ages, adoption's not going to be the answer, because they would be devastated by the idea. In other words, they've got these very intense, sometimes harmful, but very meaningful relationships with their parents, where an adoption order is not necessarily going to make them feel better about themselves or their lives. So I think we have to look at extensive reforms, and really extensive reforms around how to do out-of-home care to reduce the impact of impermanent care on children's felt security.